Welcome back, and thank you for staying with us. Well, the discussion shifts to COVID-19 again.
They did shift from COVID-19 before because of the pump price of the juice, because of the pandemic and all of that. So we're still there.
Our whole life is now just ruled by COVID-19.
No.
And
no, not my life.
oh, okay. Okay. We're trying not to make it rule our lives. Even
We
though
should
it's a
ensure that it doesn't rule our life.
It's a major part of our lives, and that's why we're shifting focus now from talking about the pandemic and lockdown and all that. Let's talk about the waste that is generated as a result of COVID-19.
The things we're doing in the midst of all of this.
So there's more hospital waste. There are masks everywhere. There's sanitizers everywhere.
Sanitizer bottles
generate waste. So how do we look after, or how does society take care of all this sudden waste? I remember that when we were talking about waste disposal in Lagos State, maybe about a year ago or longer, we actually focused on medical waste, and we were told, don't go there, that's a different topic entirely. There's a special way in which you're supposed to dispose of medical waste. But what do I know? Mr. Ola Oresoya is a special advisor to the Ogun State Governor on environment matters. He's here to tell us all we need to know about this. Good morning.
Morning.
And thank you very much.
Thank you. Thank you.
If you recall, he was the general manager over at Loma. So he is the person to be asking all these questions. Now, let me begin by asking you, Mr. Oresoya, how hazardous are these wastes to human beings first, before we talk about how it is hazardous to the environment?
Well, healthcare waste is generally hazardous, and the hazardous component of typical healthcare waste is about, according to the WHO and studies, about 15–20% of the content of healthcare waste. It's very, very dangerous, hazardous. And the hazardous component, they're actually made up of highly contagious waste, and you have also toxic chemicals, all right, and you have a radioactive component in healthcare waste.
So, this is scaring me already.
Oh, yeah.
But at the end of the day, okay, right now there's all manner of there's waste being generated. I mean, we have sanitizers. They're all in plastic bottles. So you find that there are many plastic bottles out there besides the ones from the soda, and this is considered somewhat inflammable, considering it has alcohol in it. There are also face masks that are being discarded. I mean, we're told that each individual should use one face mask per 1 or 2 hours. So in 24 hours, you're supposed to use 12 face masks, as the case may be. That's huge waste, even though there are very few people who are complying to that. But how should these things, as dangerous as they are, before we even get to the hospitals, I'm starting now from us at home, on the road and all of that, how should we dispose of this?
Okay, fine. For this moment, the best we do is to discard them into our waste can, because there's no special can to tell you that, household waste, this is healthcare waste, but household waste. So beyond even the face mask, beyond the sanitizers, there are a lot of health issues at different homes where people have to use special needles, syringes, and the rest of it. These things are a component of household waste that comes out. But for this moment, yes, the main problem, the main challenge right now is the number of the masks that we just have to use. And the really scary part of it is that the masks are recyclable. And you're already having scarcity globally. And there are countries that are already recycling and exporting this to other countries who are asking for this. So you will not be surprised to see that some of the masks we are importing now, some of them are already recycled. Because the mask, when you sneeze, you cough inside it and you're infected, what you have in there is the pathogens, the infectious pathogens that are already virus, that are already staying in there, and that you dispose them with your waste can. So the entire waste can is contaminated. And that you have waste collectors that will come and pick this. And not all of them are well protected. They get in contact with this, and they transfer this anyhow. So beyond the index cases, yes, was imported. Now, the local transmission is a real issue right now, how we control it. And this is one of the main sources, the back-end service, but it's the main source, it's not a source of distribution of this virus within the society. So when you hear the statistics being displayed, I think last week, before the lockdown, in justification of the lockdown and isolation, the statistics looks scary, ambiguous, or bogus. But the reality shows that, look, there are ways this thing you can spread it. And this one critical way in healthcare, mismanagement of the healthcare at household level, it can spread. There's so many people right now who are not reported because this thing is don't have symptoms of this virus, but it's right in there. And there are some that are getting treatment in their homes who are not going to isolation centers, and they are disposing of this mask in the waste can, and this thing gets transmitted. And that this is the real challenge facing us right now. And that's the secondary level of the challenge that we have to face. It's not just about the index cases right now. It's not just about those people that are just arriving in Nigeria right now. The virus is here with us, and it's not being transmitted because of the poor infrastructures in handling the waste.
When you say infrastructure here, is it information dissemination or infrastructure in terms of collection of the waste from homes?
Yes, collection from homes, collection of waste from homes. Then the education, we need to educate our people now. We need to now tell people how to dispose of the masks. The masks have to be disposed of carefully now.
So how do we dispose of them?
We need to have maybe a kind of a colored bag or identified bags. Every home must dispose of, or every offices where you are disposing of your mask. Don't mix it with the domestic stream. Put it in a particular bag. And yes, you can have people that will collect this and dispose them carefully. Right now, most of the infected masks are going right into the waste can. And this is a way, it's another back-end area where we are spreading the disease right now.
Okay, now in parentheses, where does waste from hospitals go? To the landfill?
Well, for Lagos, for example, let me take you back to the Ebola case in Lagos. The disease was contained because there was a system, there was a structure to capture the flow of healthcare waste in Lagos as at that time. Healthcare waste system having the appropriate policy and a structure started about 2006 in Lagos, and not knowing that we're going to even have kind of a Ebola problem that we had at that time. So it was a beautiful thing that the people that went to collect, the waste collector at the hospital where the index case came, they were already trained, they knew what to do, and that the Ebola waste was contained right at the hospital. And at the isolation center then, at the hospital where all the infected people were cared for, there was a particular system. Lagos had a thermal destruction process called the hydroclave machines, where all the waste stream, healthcare waste in Lagos at that time flows into that system and are being tracked. And you have, Lagos has a structure, and I believe other states where I work right now, Ogun State is taking cue from there. We're building such structure because of the kind of an outflow from Lagos. Or whatever happened in Lagos, if Lagos sneezes, Ogun State will catch cold. So definitely. So whatever Lagos is doing, Ogun State has to do and replicate to protect Lagos and to protect Ogun State. All right. So these things must flow into a kind of a system whereby all healthcare waste are properly tracked, captured, and disposed of properly in... no. Incineration is not really advisable in this part of the world because of the risk of improper incineration. If you cannot incinerate healthcare waste at about 1,000 degrees centigrade, then you'll be running the risk of producing more dangerous items. If you are chlorinated...
That's hot.
Yes, because you have to destroy some of the pathogens. They don't get destroyed until they get to that stage. Chlorinated items, if you put them under incineration, and you'll be releasing furan and dioxins. All right, and these are cytotoxic materials, can become carcinogens,
So
methanogens.
And trust us to want to burn them in our homes in the name of trying to dispose of them.
We've been doing this. You know, there are so many hospitals that have been doing mass burning, and this has been another source of problems, okay, within the hospital environment, where you burn healthcare waste at lower than 1,000 degrees. What you'll be releasing, okay, you'll be releasing, if you burn some of these organic waste, I mean, pathogen, I mean, if you burn these tissues under such temperature, what you now be developing kind of, I mean, resistance microorganism, okay? They are drug-resistant microorganisms that you'll be breathing, okay? And these are real source of contamination within hospital environment itself, all right? This is where healthcare workers are exposed to most of these dangerous things because these things are in the air. So visitors, patients, they get contaminated, they get bigger problems from improper waste management in hospital environment than really the problem that took them there in the first instance. All right, and the healthcare workers are exposed to all these dangers most of the time. And it's a cause for worry. And most of our isolation centers that we're having right now, we have patients there. And most of these patients, by calculation, we know the volume of waste that will be coming from those centers right now. If they are not properly disposed, if you dispose them in situ, where the hospitals are, I mean, these centers are located not too far away from dwellings. If you burn them there, what you'll be releasing to the society, to the environment, is worse than what you're curing. And that we need to show concern. So there should be a control, a regulatory control, made by the National Disease Control Agency or whoever want to do it, needs to look at all these isolation centers and what do we do with the waste. We need to be very sure we're handling them properly.
Okay, as we wind down this, let's look at this home thing, the mask. I know you said we should dispose them properly. Can we just break it down for the viewers especially? The masks that people are wearing,
Right.
the sanitizer bottles and all of that, the wipes, how should we dispose them in our homes before these guys come to pick them up?
We should have a different trash bags where you put all this because already they are potential contaminants. Because if
whether you're contaminated or not.
Assume they are already contaminated. Assume they're already contaminated and don't mix it with household waste. Otherwise, you'll not be doing the society any good because they get transmitted. You'll be transmitting more diseases. If eventually you find out that, oh, you had it and you use a mask, you dispose of the mask carelessly, you've already exported the disease somewhere else. So we should be careful to dispose. We should have a separate trash bag where you dispose of your mask in offices and in homes right now.
Okay.
But it can still go when the trash van comes to pick up the trash.
Yes, well, they should label it and let the collectors know that, look, this is healthcare waste, so that they dispose them carefully. And I'm sure most of the waste management agencies right now, they're telling their people, the PSP people that are on the street, they're collecting waste. Because funny enough, more waste are being generated from homes now. Consumption, domestic consumption.
Everybody's home.
All right, and you cannot leave this waste lying there because we had a problem of Lassa before even this problem. So, and Lassa itself is a public hygiene problem. And people are still dying off from this problem. So we should not be very careful.
So I get a bag, I put in my face mask.
Yes.
I put in the used face mask. I put in my empty sanitizer cans.
Exactly.
And tie it.
Right.
And put a tape on it.
Put a tape on it, say healthcare waste.
Yes. So that at least you have a duty of care and you've satisfied that at that level.
Okay.
To protect
so
the
if the other guys don't do a good job of observing that labeling, I am free?
You've done
your conscience will be clear.
Your conscience is clear. Right now, many of us are doing it because we don't know that we are also transmitting problems out there. You may not be contaminated. Some other guys who is already contaminated may not know and is already distributing this all
Mr. Arasaya, this whole, the idea of waste management, we were still going through the process of understanding waste management, even separating. Do we need color coding in this case, or just any bag will do? Some people might say, I don't have a bag that's color coded per se. Do we need color coding, or just get any bag and make sure that waste is put in there and you tie or seal, as the case may be?
Well, part of our preparedness should have been this kind of proper storage of waste at household level. And yes, for every home, having a red bag, red in the haircare waste means a highly infectious waste. So if you have a red bag in the house, yes, put it in there. So the waste collector are trained to know that when you see a red colored bag, handle with care. You don't dispose, you don't commingle with the general waste. You take them to the healthcare facility, the treatment facility for healthcare waste. So, but in the situation where you don't have this red bag, you can still use the black one, but please label it. Just do the society good, all right? It's not just about you being isolated right now. We're thinking of the larger society. We think about the vulnerable group out there who may not know, all right? So when you use a mask, and if your mask is a disposable mask, you dispose it responsibly. But if it's a reusable mask, that is why at times it's even recommended that you use reusable mask, that you just wash, even if you have the virus on it. By the time you put it in soap and wash in your machines, the virus is gone. Ordinary soap can clean this virus. So if you use reusable mask, fine. You'll be doing not a lot of good. But if you have to use the disposable one, and the most one we all see around are the disposable ones, except the ones that have to be clinical masks, and the clinical masks have to be disposable. So those are more dangerous ones. But at household level right now, everybody just assumes the other fellow has this virus and do it properly.
But we all don't have to use those disposable masks like the ones used in hospitals, do we?
No.
We have been shown all kinds of ways as to how we can make our own masks.
Exactly.
Or just fold a bandana and tie it over our nose.
Tie it, right.
Those can also be effective.
And just make it reusable. Just wash.
To reduce the waste.
To reduce the waste, to reduce the transmission. There is the possibility of transmission of this
through waste
at this time.
Mr. Arasaya, thank you very much. Let's just say that you scared us at the beginning, but we're a bit more relaxed now, and we shall clear our consciences by looking for red bags if possible. And if we can't find red bags, we'll take any bag, put our health waste, our masks, our
empty sanitizer
bottles in them, and tag them healthcare waste. Thank you very much, Mr. Ola Oresanya, Special Advisor to Ogun State Governor on Environment Matters. Thank you very much for coming to educate us this morning.
My pleasure.
Sunrise will be right back with another interesting conversation. Do join us.